Assalamualaikum, like previously I stated, and good evening to everyone. Of course, who is watching currently through FB Live, and those who will be coming in soon from Zoom. Please do invite others to come in. So our topic for tonight's talk is psychiatry. Now, our special guest is Dr. Aida Harlina Abdul Razak from batch SPM 1992. So during her SPM days, she was an LDP in the Sidang Redaksi Bitara and also the school representative for bola baling and netball. So it doesn't stop there. She is a very holistic student. She was also in the team Quiz Sejarah, where they won first for schools in Larut Matang and Selama. Okay, so after her SPM, she obtained a scholarship to do medicine from JPA and performed her A-levels at Cheltenham Ladies College in Gloucestershire in 1993 to 1995. After her A-levels, she did her Bachelor of Medicine and Bachelor of Surgery degrees at the University of Glasgow, 1995 to 2000, where she graduated in July of 2000. So after her studies in Ireland, Scotland, I think it's Scotland, right? Scotland. She pursued psychiatry at UKM, where she graduated in 2015. So her psychiatry studies at UKM was at the level of doctorate. Now, during her career, she's worked in various hospitals in Scotland. Yes, Scotland. Glasgow is in Scotland. Hospitals in Scotland and Klang Valley before finally working as a consultant psychiatrist currently at Hospital Serdang from 2017. So please welcome Dr. Aida Harlina to the floor.
Okay, Assalamualaikum and a very good evening. Thank you, Iman, for the kind and lengthy introduction. Okay, so here we go. So I've been given the task to talk about psychiatry for whoever's interested, or if anybody yang tak pernah tahu what is psychiatry, I hope this talk would enlighten you a bit about what the field of psychiatry is. Okay, so yeah, like Iman mentioned earlier, I'm currently working in Hospital Serdang. She went through this my bio earlier on as well, and yes, Glasgow is in Scotland. Yeah, Iman. Okay, so yes, after, I think I can elaborate a bit about my working experience. After I graduated in July 2000, I did my housemanship in two hospitals in Glasgow, the Glasgow Royal Infirmary and the Royal Alexandria Hospital. So unlike in Malaysia, which I think many of you who are interested to do medicine, you know that housemanship in Malaysia is 2 years, and we have to do 6 postings here in Malaysia. But back then, we only had to do 2 postings, yeah, a surgical base and a medical base. And then after I worked for a year and I completed my housemanship, I went on to do pediatrics at the Princess Royal Maternity Hospital in Glasgow. Masa tu I thought I minat peds lah. But then after 2 years of working abroad, I thought, okay, I think it's enough. I want to go home. So I went home, I returned home actually, late 2000. And I started working in April 2003 in Hospital Klang. So I had to do my compulsory ONG posting as a houseman. And then after that, they put me in anesthesiology, which I thought at that time, I minat pula NS. So see, early on I minat PEDS, but tu macam, okay lah, try NS. I quite like anesthesiology. And then because of logistic reasons at that time, I requested to move to Putrajaya. And in Malaysia, you can't really get a department that you want. You can state your want, but if another department is lacking doctors, they would put you to that department that require your service. So in Putrajaya, I worked in emergency department before later on I moved on to ENT. And then I was like, malas lah nak on call. So I decided to try public health actually. So I applied to work at the Ministry of Health headquarters in Kerjaya, and I was in charge of the Family Health Division department there for about 2 years. Okay, so you can see that with my vast experience in so many fields of medicine at that time, eventually I decided that, okay, I have to do something. And after much decision, I don't know, I decided to do psychiatry. Not something I wanted to do to begin with, but along my career line, I thought, okay, this is something I'd want to settle on as a career. So yeah, in 2010, I applied for the master's program through KKM, and I was placed at University Kebangsaan Malaysia to pursue my master's in psychiatry. So I think everyone knows, since dah banyak career talk before this, master's program in Malaysia is minimum 4 years, but if you have issues, they allow you to extend up to 7 years. So as for me, I embarked on my journey in 2010 and finally graduated in 2015. So extra 1 year. Okay. So for the benefit of people who's not sure what psychiatry is, it is a branch of medicine focused on the diagnosis, treatment, and and prevention of mental, emotional, and behavioral disorder. Yeah. Okay, so we are doctors. Okay, so we are doctors who specialize in mental health and mental disorder. Basically, we treat people with mental illness, whereby we need to evaluate, make a proper diagnosis, and plan a treatment for these patients.
Dr. Aida,
yeah.
Have you started sharing your screen yet?
I have. Oh, tak ada.
Okay. Tak ada.
Oh dear. Kejap nak cari kat mana.
Just press the share screen, the green button.
Kejap. Tak keluar lah that toolbar.
Dia ada dekat atas usually. Dia macam you kena scroll to the top and then the toolbar will go down.
Right. Where is it? Tak jumpa lah. You know, I actually practiced with my son earlier. Kita orang dapat share screen.
Oh, okay. Kejap. Let me stop sharing and then you try again. Okay? Okay. So I've stopped sharing. Okay, how about you try now?
Boleh tak?
Okay, yes, wonderful. Okay, I can see your screen now.
I can't see my screen now. Okay, are we at the responsibility?
Okay. Yes, we are at responsibilities. Now psychiatry.
All right. Okay. So I read through this already. Excuse me. Okay. So yeah, basically, to be a psychiatrist, you have to be a doctor. Okay. And then prior to applying the masters, you have to already work at least 3 years as a medical officer before you're eligible to apply for masters. Itu kalau masters program ya. Responsibilities. So we treat patients who have psychiatric issues, and then the common psychiatric issues. I think people know major depression, depression, which is one of the commonest mental illness for now. So there's anxiety. There are a lot of people stressed out there. There are patients with insomnia, and the core illness in psychiatry is schizophrenia and bipolar mood disorder. But we also see a lot of personality disorders nowadays juga lah who come to the clinic. Okay, we also do mental health promotion talks. We do services but this is mainly regulated by the public health, not psychiatrists lah sebenarnya, but they do ask us to help out. Okay, and yeah, I think as for other field pun, you have to do educational talks. We do trainings for our junior psychiatrists, for the medical officers. I wonder if people have heard of psychological first aid. For psychological first aid is emotional support that we give for people who are under stress, so that with this support, we hope that they don't develop, or whatever mental health issues they have, they don't develop mental disorder. So we do a lot of PFA for now, for this current pandemic, because our frontliners, they are stressed. So we do PFA for the frontliners, we do PFA for the patients. So this is something we do a lot. So we work hand in hand with the counselors, with clinical psychologists. We do PFAs dekat quarantine places. So again, with the hope that these people who are under stress do not develop mental health problems in future. Okay, unique for Hospital Serdang, we are the standby hospital for any disaster that happens in KLIE. So kalau ada kapal terbang meletup ke, ada chemical leak ke, or whatever, we go there. But we are psychiatrists, we are not emergency people. So any physical issues will be dealt with by the emergency department staff. So again, our role is for a PFA. So we go and see victims, staff who are stressed there. We provide psychological first aid, and we are also in charge for hostage negotiation. As we know, sometimes, which doesn't happen enough time, terrorists or orang jahat lah, they take hostages. And police have decided that psychiatrists should play a role in this negotiation team. So macam canggih je lah, tapi so far, touch wood, I've not been involved in any real ones. Drills, I do a few. Okay. So, and also lastly, for any other career, there's, well, not all, in medicine especially, we embark on research and clinical audit. I tak minat sangat sebenarnya. Mostly orang universiti lah yang into all this research. Tapi as a clinician, I do audits, something so that we improve our services further. Alamak, Iman. My slide? Okay.
Okay, yeah, next, ready.
Boleh kan nampak ke? Hello?
Nampak?
Okay, I proceed. Okay, so how does one become a psychiatrist in Malaysia? Again, macam I cakap, basic memang you kena you have to be a doctor. So in Malaysia ada two pathways. One is what most people do during my time. We do master's program at the local universities. Dulu mainly UKM, USM sahaja. But now UPM, UIE and UITM pun offer this master's program. So this one you have to apply and you have to have a few criteria lah to be selected to get the scholarship. So most of the time it's a scholarship, but I know a few of my colleagues who actually pay for the program. Now more and more people are doing the parallel pathway, which is the MRC Psych. So yang ni you bayar sendiri. Yang orang lagi satu, most people are going towards MRC Psych sebab satu, it's not easy to get into the master's program. Number two, master's program is very structured. First year you kena buat ni, second year buat ni, third year buat ni, and then you have to go to various postings. Parallel pathway ni is a bit more relaxed. You decide bila you nak exam. And then dia tak adalah macam master's program where you have to write case protocols, ada banyaklah benda. So it's a bit relaxed. But then again, now for psychiatry anyway, I don't know about the other fields of medicine, we are regulating this parallel pathway punya candidates just so that they are at par with the master's program. Macam tak fair lah In the end, you jadi psychiatrist juga. Tapi just because you bayar sendiri, you tak payah buat all these compulsory things that the master's students are doing. Buat research, all the case write-ups and whatnot lah. Senang lah. So, when you get your certification as a psychiatrist tu, kita kena go through gazettement lah to be registered as a specialist. For master's students, gazettement is 1 year, and somehow for MRC side is 2 years. This is decided upon by MMC. So don't ask me why. Alright. So you dah jadi psychiatrist. For me, I'm a general psychiatrist. But in Malaysia, there are subspecialty under for psychiatry. There's child and adolescent psychiatry. There's forensic psychiatry, psychogeriatrician, addiction psychiatry, consultation liaison, community and psychosocial rehabilitation psychiatry. So I'm not going to go into details kalau nak tanya kemudian, but you can start applying for this subspecialty after a year. Sorry, you dah gazette. Lepas tu, I think after a year of service, you dah boleh apply for the subspecialty. Sorry kalau ada psychiatrist lain yang tengok and I punya fakta ni salah, stand to correct me. Thank you. Okay. Psychiatry services in Malaysia, just for knowledge sharing. So all states in Malaysia have hospitals with psychiatrists. Most psychiatrists are concentrated in Klang Valley. Ramai orang kata tak achieve, tapi to be fair, this is where the community is concentrated juga lah. So for hospitals yang tak ada psychiatry, we have doctors visiting psychiatrists to district hospitals, whereby normally once a month they go and visit these district hospitals. And then we also have psychiatrists who extend services dekat klinik kesihatan. Like myself, every month I will go to klinik kesihatan Salak Tinggi to offer psychiatry services kat situ. So these patients tak payah susah datang hospital lah. So they can just go to the nearby clinic and get a psychiatric treatment there. Okay. We have 4 mental institutions in Malaysia, which is in Tanjung Rambutan, Hospital Bahagia Ulu Kinta, in Johor, Tampoi, Hospital Permai, in Kuching, Hospital Sentosa, and Hospital Mesra, excuse the title. Why we have these institutions? One, for long stay patients. Sometimes beds tak cukup in the normal hospital, and some patients need longer stay to stabilize their condition. So we can send these patients there. Number 2, this is where forensic psychiatrists reside. Okay, for criminal cases actually. Sometimes criminals, they suspect the judge or what the lawyer suspect that the criminal, the perpetrator might have performed the crime when he's not fully sane. So we can summon them under the Act, Penal Code 341. So they go to this forensic ward where they will be assessed by the forensic psychiatrist lah. And then the forensic psychiatrist with their expertise will decide whether or not during the act that person is mentally sane or insane. Senang lah. Okay, so as of other fields of medicine, there's the government and the private services. For psychiatry, jaranglah ada private hospital yang offer ward admission, mainly outpatient sahaja for private. So for government, of course kita ada outpatient clinics for stable patients. Unstable patients get admitted. Some patients where yang they have the illness, but they are not, they have no insight about the illness. Macam we want them to be well, but diorang tak rasa diorang unwell. So diorang tak rasa diorang perlu pergi hospital, diorang tak rasa diorang perlu makan ubat. So for these people, we offer community home services. So our community nurses, our doctors will go and visit these people at home to see how they are. And normally these patients kita bagi injections sebab diorang tak willing nak makan ubat hari-hari. And on top of treating patients with medicine, we also offer rehabilitation centers lah. You know, patient with severe mental illness kan, they lack skills. So these centers offer them skills, and then when they're well, we help them to find jobs. We call it supported employment. Okay. So as for now, kalau ikut WHO punya recommended ratio, ideally there should be one psychiatrist per 10,000 population. So kat Malaysia sekarang, as for 2020, I think there's almost 500 registered psychiatrists in government campur private. So we are so way jauh from whatever the recommendation by WHO. Okay. So that's something brief about psychiatry. So why did I choose psychiatry as a career? Tadi tak nampak slide, maybe I should go back. Okay. Kalau you all tengok my working experience, sejak I graduate sampai I jadi master student in psychiatry in 2010, I tak pernah pun buat psychiatry. Psychiatry wasn't actually what I desired to do to begin with actually. Okay, one thing for me, I rasa lah, when you become a doctor, you can somehow eventually realize you need surgical base or a medical base person. So I think after 2-3 years of working, I realized I'm a medical base person. I memang, especially masa I buat ENT lah, I sudah, I tak mengejar lah nak masuk OT, buat nanti kan surgeon offer you buat tonsillectomy ke whatever lumps and bumps. Memang I tak heran. I rasa semua benda tu merah je, kan I salah potong. So I would rather stay in the clinic. So that's when I realized I'm definitely not a surgeon. I can cut whatever. And then, so yeah, either medical base or surgical base. And then you have to also decide that you ni suka public health or you suka research ke. By then, for me lah, I decided that I would rather stay in a hospital-based setting. I tak rasa I boleh kerja kat klinik kesihatan. So family health medicine is not for me. So definitely, I tahu I tak nak buat active on call. So kalau tak nak active on call, masa tu dah tinggal family health, public health, all the labs semua tu yang pun I tak minat juga. So and then when I was working in KKM masa tu, I got close to this one senior. She's a public health physician already, masa I kenal dia. But as a medical officer, she served psychiatry for quite a long time. So she was the one who sparked the interest in psychiatry for me. Itu satu. When I was in KKM, I mentioned that I work for Family Health Development Division kan. I was in charge of adolescent health kat situ. So we develop materials for adolescent health, and for masa nak develop those materials too, we work with a lot of other fields yang to do with adolescent, and one of them is psychiatry. So I work a lot with psychiatrists masa tu, and I was like, again, people who work with me masa tu really macam very pleasing. Yeah, they spark interest for psychiatry to me lah. So yeah, end up here I am as psychiatrist. So like macam I cakap tadi, no active on call, and I want to be hospitalist. Oh yes, lagi satu aku nak cakap. In Malaysia lah especially, we have a basic clinic. Kita nak cepat-cepat settlekan our patients. So we end up treating the illness, not the person. So I don't like that. To me, I like my time to talk to the person. You understand the person. You know, instead of a diabetic person tak makan ubat, kena marah. Makcik, tahu tak bahaya tak makan ubat, nanti gula makcik tinggi. To me, we need to understand kenapa dia tak makan ubat. I selalu check. So I have patients, schizophrenia patients like kata, they need to be stable on medication and they have to take their medications regularly. Tapi selalu you akan jumpa orang tak nak makan ubat. So I will, to me, I will akin that situation to myself pun. Do I ever finish my antibiotic course? Antibiotic course selalunya what? 5 days, 7 days? Do I ever finish it? Tak juga. Sometimes even a 3 days, 5 days course pun I tak boleh habiskan. Benda yang twice a day, kadang-kadang pagi terlupa. So kalau I pun tak boleh, what not a patient? So yes, to me you have to treat the person as a whole. Not a patient is not just the abdomen in bed 5. She's not uncle in bed 6. So yeah. So yes, what qualities does a person need to have to be a good psychiatrist? I think as a whole, to be a good doctor lah sebenarnya. Kita definitely kena ada knowledge. Sebab you have to know what question to ask. You have to know what to look out for, so you can make correct diagnosis and plan a good treatment for that patient. Kalau patient ni macam ni, ubat ni yang suitable for the illness tapi maybe tak suitable for the patient. Like for a psychiatrist, definitely you have to have a good listening skill lah. Sometimes patient kan, cerita dia macam-macam. So sometimes you dah macam, aduh, kat dah bersusun ni. Tapi kena sabarlah, try sabar besar-besar tu. Okay, listening satu, observation. Body language is important. I like to tell my friends, I don't listen with my ears, I listen with my eyes. So sometimes it's their body reaction, the face, the movement kan. Sometimes borak dengan patient kan. Awak ni risau semacam they will go, mana doktor tahu it's body language. Active listening. What's active listening? Pay attention, eye contact. Kalau I bercakap dengan you, I mindful. You suka tak? Tak suka kan? But I do that a lot with my children, sorry lah. Anyway, so yeah. So mengantuk macam mana pun, you tunjuk juga lah you interested kan. Sometimes you punya foto dah keluar banyak dah, message punya notification. Dah tak sabar nak tengok, tapi you have to show the person you're interested. Sorry, I bukan nak kata I banyak tipu, tapi yeah, sometimes yang tak berhenti nak bercakap tu, they do challenge you. Okay, we need to be able to show empathy and emotionally validate. Meaning, if you are a good listener, you would be able to emotionally validate. What's emotional validation? Macam mana nak kata? Emotional validation is summarizing the patient's issue and paraphrasing it. It must be difficult to be in your situation. Yelah, susah lah. Bukanlah susah, tak terfikir pula caranya. So maybe as we go on, maybe when people start questions, I can explain further. Lagi dah habis dah actually. Yeah, that's it. I think the next few slides are a few photos related to my GP. Since I put them last minute, tak susun cantik-cantik, I letak sahaja semua-semua. You all just bear with me. Okay. So this is when, kalau Cikgu Aisyah ingat, this is when I give the career talk to the group Emas Hitam lah in 2019 in UM. Okay, so we do a lot of promotion, health promotion events juga lah. So this is kat my hospital in 2019, sambutan Hari Kesihatan Mental Sedunia. So we had a few talks, we had games and whatnot, just to increase the awareness. One thing about psychiatry ni, I think everyone pun tahu. Or kalau tak tahu, I nak bagi tahu. The stigma in psychiatry is very strong. Sometimes orang kan, dia rasa dia perlu jumpa psychiatry, tapi dia takut sangat sebab nanti orang kata saya gila. Or macam, I have a handful of doctors under me. Diorang tu dah memang tahu diorang kena jumpa doktor, tapi diorang risau that the career would be affected, which is not. Yeah, it's good that you come for treatment, get yourself treated, get yourself back on your feet, and then become somebody productive. Rather than bila kita ada sakit kan, you have to struggle, you push yourself, and then takut in the end you burn out. Yeah. So I pernah bagi talk dekat Museum Negara 2019 juga. Okay, tadi I mentioned about standby for KLA disaster. So we do drills under the MKN through CPRC. They conduct drills. So psychiatry datang bagi PFA macam saya cakap tadi. The emergency department staff will come and provide services for the physically injured. So biasanya dia orang akan buat malam. So this was 2018, end of 2018. It was at night. The scenario was kapal terbang meletup. And then the kapal terbang from where ke mana pun I tak ingat. Normally they would get university students to act as the yang sakit-sakit ni lah. Okay, so I was the team leader that night. So we interview patients, bukan patients lah, the victims, and see how stressed they are. And then after we see the victims, we also pergi jumpa the frontliners to see how they are, because situations can be stressful. Okay, I mentioned that we are also in the negotiation team again under MKN. So this was 2017. Another drill lah. Teroris datang sebab nak apa, I pun tak ingat lah. So me and my colleague, this is Dr. Noliza from Hospital Kajang, we took turns. She started from 8 AM and I came at 7 PM masa tu. Masa nak tukar shift. So we are part of the negotiation team. Ada polis, ada siapa lagi yang satu? Top people from the armed forces. So they talk through the phone tengah-tengah tu. So we negotiated with the terrorists lah. And then it was quite fun, a full role play. Eventually the commandos came in because the negotiation. So they managed to gun these people down. And then later, ni I dengan orang Rainbow ni, what we did was we gathered the victims, hostages. That's the word. We gathered the hostages that were yang kept hostage by these terrorists. We gave PFA again. We call it debriefing to these people again, so that kita nak tengok the stress level of these people and we nak intervene early on so that you don't go on to develop post-traumatic stress disorder, something like that lah. Okay. Ini dengan the bomber team in Subang. You remember the event where berapa orang yang meninggal dekat Puchong masa tu? Yang there was a victim who, this boy who got caught in the Lombong ke something, and then they lost 7 of their officers. And this is also the fire department where arwah Muhammad Adis. So me and my team, kita orang pergi buat PFA to the colleagues of this team. So banyak lagi lah, tapi tu je sempat letak. Okay, that's me.
Okay, thank you so much, Dr. Aida. It was very interesting, honestly. Okay, so we have one question currently from Ibrahim. So, bilakah masanya yang perlu kita berjumpa psychiatrist?
Bilakah? Okay. One have to know so bukan you have to know. It's the psychiatrist who decide. You need mental health issue or you dah masuk disorder. Okay. Many people bila ada problem tak kalau ada problem kecil pun nak jumpa psychiatrist. Tak. So when do you need to see a psychiatrist? When it has affected functioning. Physical functioning, tidur dah affected, selera makan dah affected, energy affected, those are physical. Kalau macam social functioning, kawan-kawan lain boleh perasan, dia pun boleh perasan. Kalau dulu he goes out freely, sekarang COVID lah, tak boleh keluar kan. The word anhedonia, you lost interest in things that used to give you pleasure in the past. So dah tak nak buat benda yang you in the past enjoy, okay. And then you have a lot of negative thoughts. Nothing is okay for you. Orang cadangkan, jom buat ni, semuanya negatif. This kind of people would benefit from seeing a psychiatrist. Mungkin tak perlu ubat. Maybe we will end up referring them to the clinical psychologist or the counselor to help with certain coping skills. I hope that answers the question.
Yeah, I think so. Because sometimes orang nak detect benda tu, like if they can't detect themselves, orang lain sekeliling pun macam boleh tolong kan. Okay, so following question is, bagaimanakah kita sebagai ahli dalam masyarakat boleh memainkan peranan membantu dalam isu-isu mental health?
Okay, number one. Okay. Masyarakat boleh membantu by not stigmatizing these people. Because again, like I mentioned, stigma in psychiatry is very strong. I jadi psychiatrist ni pun stigma dia kuat Kenapa kau jadi doktor gila you know, it's like that. When I joined psychiatry, one of my professor lah, dia cakap, you know, it's not just our patients are stigmatized, we are stigmatized, our chairs, our tables are stigmatized. You know, bila orang lalu klinik psychiatry, klinik psychiatry, you know, that's how strong the stigma is. So masyarakat boleh membantu dengan cara not being judgmental. Kau pergi psychiatry, kau gila ke? So the word gila is very strong. Lagi, openly advise your friends. If you like, macam Iman cakap tadi, if you think your friend might benefit from treatment, help the person to feel that it's okay to seek treatment. Lagi apa coping skills. If you see your friend stress, many different people have different coping skills, but one of the close friends can help by talking to your troubled colleague, because sharing problem, orang kata apa? Problem shared is problem halved. Boleh lah.
Yeah, talking does sometimes help lah. Okay, so another question from Cikgu Aisyah. Sejauh mana pesakit boleh sembuh? Adakah dengan ubatan sahaja boleh menyembuhkan penyakit ini atau perlukan faktor lain juga?
Cikgu Aisyah, I think she knows the question to her answer. She knows the answer to her questions, but she wants me to say it out loud. Okay. I akan always tell my patients, you jangan isolate psychiatric illness ni to physical illness. Sama je. I akan cakap, kalau you ada kencing manis, you punya gula tinggi. And what does the doctor do? They will prescribe you ubat to stabilize your gula. But does that mean that you boleh suka hati makan benda manis? That you don't have to practice healthy lifestyle? No, kan? So you have to put everything together. Makan ubat, control your food intake, or manage, tak boleh makan manis-manis lah for these diabetic people. And then they have to exercise, they have to sleep well. So for psychiatry, boleh sembuh kalau ada masalah psychiatry. I tak janji lah, bukan. The word sembuh tu tak berapa tepat lah. Boleh stabil. You can get back to your previous productive level. If you have an illness, we get you treated and we want you to go back and become productive. If not like before, better. So medication, support. We have to have support. Support system means kawan, family who would remind you kalau perlu ambil ubat. Lagi satu, who would be able to monitor you if they think you're unwell. Maybe you need to go and see the doctor earlier to change medication to help you to handle your stress. So peranan family and friends tu sangat penting.
Very true. Okay, so another question from Baim. Adakah kita masih kekurangan psychiatrist di Malaysia? I think, yes, you've already stated just now, right, with the comparison of the WHO.
Yep.
So, bagaimanakah ratio pakar psychiatry di Malaysia dengan penduduk? I think that one, maybe you can just go to your slide just now.
Can. Mana Baim kena nama dia je, Iman? So,
I think if he wants to open the camera, boleh je.
Yeah. He was asking about numbers, right?
Yes.
Yeah. So memang tak cukup lah. And I think it goes across all the medical fields pun sebenarnya.
Oh, actually, I have a question of my own. So, like you said, macam a lot of psychiatrists are concentrated in Klang Valley, right?
Malaysia, Semenanjung Malaysia and Klang Valley ialah paling ramai.
So when you go to macam the visiting, you're a visiting psychiatrist. Do you see like different kinds of cases, or are the cases quite similar based on demographics?
Okay. For me, tak berapa lah sebab I kerja hospital Serdang and I go to klinik kesihatan Puchong, which is like 10 kilometers away. So we have to understand cases that we see in klinik kesihatan are simpler cases, more stable cases. Macam if these patients come and then normally kan when these patients come, the MO will put them on the visiting psychiatrist punya appointment, and if this patient is not suitable for klinik kesihatan punya level, maybe dia punya illness tu lagi severe, and klinik kesihatan their medication yang available very limited, we will take them over to the hospital for treatment. So if your question different in a way, they are a lot simpler lah. Sebab we go once a month kan, but the doctors there see these patients on their own juga without the psychiatrist. So kalau complicated, kesianlah dekat doktor-doktor tu.
Actually, I've always wondered, like, you're a psychiatrist kan? You're a consultant psychiatry, right? So what's the difference between a therapist and also a psychiatrist?
By therapist too, what do you have in mind, Iman?
Therapist. I don't know if I watch too many shows like macam Hannibal. Hannibal is a therapist, right? There's a lot of therapists in this story. So I've always wondered, like, what are the different roles and responsibilities?
Okay.
And also the knowledge requirement lah.
Okay. Yelah, I would say I'm a clinician. Tapi kadang-kadang I guna juga word therapist kan. Okay. In treating psychiatric patients, we ask them symptoms and bagi ubat according to the symptom lah. Patient yang ada symptoms of depression, we decide, oh, dia ni depressed, kita bagi ubat depressed. At the same time, again macam I cakap, like any other illness, ubat saja tak mencukupi. So we will decide on what kind of therapy that the patient may benefit. So therapy ni ada banyak psychodynamic psychotherapy, there's cognitive behavior therapy, there's acceptance therapy, banyak terapi lah Iman. So bila sometimes lah what we therapist tu, kita orang guna that term bila kita embark these patients on therapy lah lebih kurang.
Oh, faham. Macam tu je. Oh, okay. So the name just tukar based on the benda yang tengah dibuat lah.
Okay. So patient akan cakap, I go and see my therapist. So when you go and see therapist ni kan, your doctor tu, but bila you buat session therapy tu, the session is longer as compared to a clinical outpatient setting. You tanya patient, dia punya apa tu, symptoms, kan kita dah start ubat, see how they progress. So normally it's quite, bukanlah nak brief, kadang-kadang patient setengah jam juga. But bila buat terapi ni usually structure. Even kalau psychotherapy tu, one session is 1 hour, you sit with the patient. So jadi canggih kat situ je.
Okay.
Certain therapy sama je. Clinical psychologist boleh buat, psychiatrist boleh buat. Ada certain therapy kita orang memang download dekat clinical psychologist because it takes too much time. For us. Tak boleh buat kat klinik lah.
Okay. So next question. The question is, apakah mana ni? What are usually the case psychiatry yang banyak dalam kalangan remaja dekat Malaysia?
Siapa yang tanya tu?
Actually two people.
Okay.
Two people.
Among young adults, I punya area Serdang memang banyak young adults. We cover UPM. Although sekarang ni HPUPM pun dah baru buka hospital pengajar universiti UPM. So kita ada banyak universiti around our area, and area kita orang pun cover Cyberjaya, Putrajaya. So you can imagine the population there are young adults. So I see a lot of anxiety and depression actually. Kalau young adults ni yang muda early 20s, late teens semua tu, mostly depression. But this group of people yang I nampak alami and my colleagues, kita orang sit and analyse, depression tu definitely ada coping skill punya issue. Where bila dia orang stress, they're not sure how to handle the stress, the emotional overload semua tu, they will end up self-harming themselves.
I see.
Yang datang overdose, they slash their wrist, banyaklah.
Itulah.
Self-harm behavior.
Yes, self-harm. And the factors can vary kan. Macam sometimes people like to, I think me myself already being an adolescent previously, sometimes because a big problem is society stigma lah. Macam like you said, macam it makes it hard for them to seek for help, and they belittle the reasons. Macam stating that like it's just very minor reasons, like you can settle it on your own, it's petty and stuff like that, but actually it creates such a big impact. And you said it's because of like emotional overload, right? So could you say to what extent it is something that will, like, how do you say it, like bust the myth that it will not be there in time. Macam it takes time lah to be okay.
It does, betul. As for many other illness, contoh sakit tekak, perlu ke jumpa doktor, boleh baik sendiri kan. So to a certain extent, you can cure yourself lah sebenarnya, but you have to get good support, coping skills. So these people boleh cure on their own, but there are not many people yang ada good support. Thank you. And not many people are the willingly talking people. I don't know about you, macam I senang je lah nak bercakap kan, but some people, personality orang lain-lain. So they don't share, so they bottle up their problem, and then bila dia diam lagi berubah, orang pula belittle lagi. So lagilah dia nak seek help, so end up going down that path lah.
Yeah, it's scary to see actually. Okay, so we have a question. Apa cara yang terbaik untuk mengajar coping skill pada orang yang menghadapi macam anxiety, depression, besides like talking it out and all?
Apa cara coping skill terbaik? There are various coping skills, susah nak cakap yang terbaik. What works for you might not work for me. Setengah orang coping skill dia makan, setengah orang coping skill dia tidur, ada orang pergi workout, ada orang listen to music and whatnot. So what works for you? But for ideally yang the simplest is, I would say, breathing relaxation technique. Semua orang boleh Google, boleh YouTube. It's very simple, tapi malas nak buat kadang-kadang. It really works. When you're stressed, you will get physical changes in your body. You get increased heart rate. Then bila kita increase heart rate, you will start noticing your breathing pattern pun dah berubah. So this is when you should find a comfortable place. You relax. Siapa ada apa tu? I watch dia ada kan Apple Watch.
Oh yeah, they track heartbeat.
Check heartbeat satu. When your heartbeat is high, they would prompt you to breathe, and then they would assist your breathing. Okay.
Oh, that's so cool.
You know, in my clinic, I akan ajar this breathing relaxation. In the end, I rasa macam bodoh juga. Like you breathe anyway, but I'm here to teach you how to breathe. But yeah, you have to breathe the proper technique, and it would bring down your heart rate. So people yang anxious, people yang depressed ni pun they will get worked up kan. So when you stress tu is where you should do. You know, dalam orang Melayu pun saya cakap bila orang tengah stress, ternafas kan. So I think it goes back to that part where a proper breathing would actually calm you down. So orang yang ada anxiety, it's really for them lah. Lepas tu negative thoughts. Kita suka layan negative thoughts kan?
Yes, overthinking.
Yep. Well, you cannot stop the thoughts from coming in. Kan? Dia akan datang. Zap. It's how we manage the thoughts. Salah, tak nak fikirlah. So you change, katalah tengah duduk kat sini, makes you continue thinking. That's it. You bangunlah. You pergi mandi ke, you pergi dapur minum air ke, with the hope that thought tu terminate and you tak payahlah buang masa ruminate. Sakit jiwa.
Good.
Macam biasa baca.
Everybody goes through issues. Okay, alright, so another question. Apa major symptom yang menunjukkan orang tu dia ada masalah kesihatan mental walaupun kita nampak dia macam biasa selain cedera diri sendiri? Macam benda tu kadang-kadang like it's tersorok kan. So dia kadang-kadang boleh jadi stres biasa je, bukan sebab ada problem dengan kesihatan mental. So kiranya this person is trying to ask like how do you
that
differentiate?
Person has no symptoms. Differentiate, or a person has no symptoms suddenly end up harming themselves ke? Or differentiate? I tak faham.
Okay, I think what she's trying to ask is how do you differentiate whether dia ada mental illness ataupun like stress biasa. Macam sebenarnya doktor cakap tadi like kalau ada batuk je macam tak payah jumpa doktor. Tapi kalau macam like we know macam when it escalates tu, like in this case, when does it escalate?
Alright, okay. If you're close to that person, itulah kita nampak change in behavior. That's one of the glaring thing. daripada senang a happy person become quiet, or kalau a quiet person tu lagi quiet, and then become overly sensitive. Simple matters you cakap, they become snappy, easily irritable. Again, changing the behavior lah. Macam functioning affected, social functioning, dia punya occupational functioning, meaning kalau student dah tak berapa perform, kalau orang bekerja lah, occupational, meaning they're not productive as they productive before.
All right. I hope that answers to this person. And if you have further like questions, just please ask. Okay, so another question from Ibrahim Baim. Masalah anxiety dan depression dalam kalangan remaja, adakah faktor utamanya adalah disebabkan kurangnya perhatian daripada ibu bapa?
I don't know what you getting at. Okay, as of any other illness juga, in psychiatry pun banyak factors that would contribute to a person developing the illness. So if I pick depression itself, or anxiety lah, okay, genetic factor plays a role. So kalau kita orang interview patient, macam breast cancer juga, dia akan tanya, you ada mums or auntie yang ada breast cancer. So in mental illness pun kita akan tanya, any of your family members who has mental health issues, so genetic factor. But that doesn't mean if your mom ada anxiety, you will get anxiety. Okay, because other factors play a role. Growing up, social learning theory, kalau you biasa tengok mak you jenis yang kecoh-kecoh, kalau benda kecil pun dia dah, okay. Normally, kita ni, we would tend to imitate the person that we are close to. Social learning theory. And then, so disebabkan kurang perhatian tu, yes and no. Again, it goes back to our coping skill juga. So, adalah peranan tu. Kalau macam a child growing up, parents tak bagi attention, love and affection kan. Kalau ikut Freud's punya theory, anger turns inward. So, dia marah kat parents dia because dia tak dapat this love, affection or whatever that he feels that the parents should give him. Dia marah kat parents dia. Tapi as a child, kita tak boleh nak marah kat parents kan. So, kalau ikut Freud lah, anger turns in. So, anger turns into end up jadi depression. So, tapi tak semestinya kan. Ada je budak yang tak depressed pun walaupun parents sibuk kerja. So, again, it's multifactorial.
I see. Betul. Okay, I remember you said that you would like to have it finished within an hour.
I don't mind, it's okay.
Okay, you don't mind. All right, cool. So if we have any questions coming from FB, please do ask. And if there are any more questions in Zoom, please do ask as well. We're still open. But I personally would like to ask, because like you said you didn't want to be in family psychiatry,
medicine.
right?
Family medicine.
Yes, family medicine. Why is that, may I ask?
Okay, family medicine specialist, for your information, Iman, kalau you're not aware, it's kira GP, nak kata GP. They're the gatekeeper. They're the one who are specialist yang in charge dekat klinik kesihatan. So kat klinik kesihatan tu, you have your medical officers ramai-ramai, and family medicine specialists are the one yang in charge of the klinik kesihatan. They went through training juga, at least 4 years juga, where they learn about management of various medical problem. So orang diabetes, orang ada thyroid problem, orang ada whatever problem, biasanya patient kena pergi klinik kesihatan dulu. They cannot come to hospital right away kan. So
okay. Now
family medicine specialist yang screen these people.
Oh, so it has something to do with klinik kesihatan that you're not very fond of. All right. Okay, now I understand.
I have hospital base.
Oh, okay. All right. I think We don't have any questions anymore.
They read my mind.
In FB, we also don't have any more questions. Okay, so I guess that's it. But please stay,
Okay.
Dr. Aida. But thank you very much, everyone, to those are watching from FB Live and also to those who are in Zoom. And if, say, you want to promote this video to others, to acquaintances who you know may be interested in psychiatry or in general need to seek.
Please come.
Yes, please come.
Sebelum
Please watch
terlambat.
the video. Yes, sebelum terlambat. You can just watch the video on our channel, TEPEN TV. And we will also have other uploaded videos there. So please subscribe and just hit the bell button to receive notifications. All right, so thank you very much, everyone.
Okay, thank you.